I'm going to demonstrate how to do a finger stick blood sugar with our AccuCheck Inform 2 machine. Your AccuCheck machine may come in a carrying case, and it'll include your blood glucose monitor, or the monitor may be on a docking station. You may have to put it in the carrying case. So before I do any of my equipment, I'm going to do my hand hygiene. I'm going to remove my meter from the carrying case and turn it on. And remove my test strips, bandage, 2x2, lance, and alcohol swipe. You'll enter your user ID. And then I'm going to click on Patient Test. It wants me to enter the patient ID, so I'm going to hit the barcode, and I'm going to scan my patient's wristband. I'm going to ensure this is the correct patient, and click the check mark. Then I want to ensure that I have the strip lot, so I'm going to hit the barcode again. I have the correct strip, so I'm going to remove a strip from the vial. I'm going to insert my strip with the arrow towards the machine gently. I'm good to put a drop of blood, so I'm going to prepare my 2x2. Prepare my alcohol. And even have a bandage ready. I'm going to ask the patient if they have a preference of which finger I use. I'm also going to look at the fingers to see if there's any calluses, see if their hands are warm or cold. If their hands are cold, you may need to warm them ahead of time. The patient doesn't have a preference, so I'm going to use my first finger. And you want to do your lance on the side of their finger versus the tip, because of the nerve endings can cause more pain. So I'm going to cleanse the area. As this is drying, the patient's able to hold their hand. I'm going to prepare the lance. You twist and pull the blue end off. If you try to pull directly, it'll have the lance will misfire and you will not be able to use it. Now that the patient's area is dry, I'm going to firmly press the lance against their finger and press until I hear it click, release. At this time, I will lightly press on the finger to have a drop of blood. You'll wipe the first drop of blood away, and then you can gently squeeze the finger for another drop. When I have my drop of blood, this is my finger. You're gonna, at the side of the strip in the front, you're gonna press the drop of blood and the machine will suck it right into there. If you do it on top, it will not give you a reading, or if the blood is on the bottom of the strip, it will not give you a reading. So now I have my reading. If it's not within a normal range, we can click on the little conversation bubble. We can enter, I need to repeat the test, I'll notify the RN or physician, or if they've been treated, you can click that, check mark it. I'm okay with my results, so I can green check mark it again, and I'm back to my main screen. If I forget what my patient's test is, Then I can do review results. And it'll give me all of the patient's results for the day, or I can do individual patient. And I can barcode and scan the patient's wrist. And it'll show me all the results for my patient for the time at the hospital. Go back to my main screen. I'm finished, so I'm going to turn it off. I want to remove my strip with the blood on it and discard this in the trash. I'm going to discard my lance in the sharps container. And then before I place this back in the carrying case, I'm going to wipe it with the chlorhexidine wipes provided in the unit. And cleaned, I can place this back in, return it to the docking station so that it is able to load up to the computer system. I've thrown all my trash away, and I'm going to do my hand hygiene.